Recording in progress.
Great, thank you. All right, when is that, guys, everybody? We're here for a. I think that's better. We're here for a consortium of cities meeting. Thanks, everybody, for coming over to the courthouse. Appreciate it. And unfortunately for those online, we have a beautiful spread. So thank you all for staff for putting that together. We appreciate it. Let's see here, today's October 22nd, 2025. We're gonna do our introductions as we do. You should have received the agenda from Nick, so if anybody is needing that, check your email first. As Nick was the sender. And then if anybody here in the room needs a printout, just let us know and we can go grab a couple off the printer.
Oh, no, I was waiting there for it.
So we'll do really quick. I want to just take a look at the agenda, make sure everybody's on the same page. We've got a behavioral health roadmap update, and then we've got just our discussion as far as our general presentations. Just a reminder from a process standpoint that because we'll be doing it in December, so this is kind of like a prepare yourself. All of the members have shared ideas for topics, and that's how we do a vote and get everything ready for the entire year. And so this one was the ask was to talk about mental health, which was kind of a big topic. So we put in the questions just to kind of prep everyone's presentations. We try and take a break. We'll try and take a break at 7:05 just to give us a little stretch and ability to do some network, et cetera, if you need to. We do have a housing needs assessment presentation as well. And then updates as always on community events and things like the best event coming up here soon. I do want to just check in and make sure, is there anything else people need to add or wanted to add to the agenda? Great. Thank you. Okay. So then let's start with introductions, and I'm going to start on the screen first. And as always, if your name and title, if your title doesn't indicate where you are in the region, just share that with us so we know where everybody's joining us from. And let's see here. All right, let's start. And I'll present. Well, we'll just have everybody go. So Michelle, and then Caleb, and then Christina, and then Heidi. Please.
Hi, everyone. I'm Michelle Webb. I'm the Behavioral Health System Manager for Boulder County, and I work in the Community Services Department.
Thanks for joining.
Thank you.
Hi, everybody. This is Caleb Dickinson, City of Louisville. Sorry, I'm both remote and no video. It might not even be me. But yeah, I'm Mayor Pro Tem of Louisville. I'm happy to be here.
Mayor Pro Tem, thank you. We appreciate somebody putting a name on the screen. Thanks for joining.
Good evening, everybody. I'm Christina Pacheco, Human Services Director for the City of Longmont. Happy to be here.
Thanks, Christina.
Good evening, everyone. I have my voice back for those who heard me 2 weeks ago. Yay! Heidi Grove. I oversee the Division of Homeless Systems and Coordinated Response in the Boulder County Housing Department.
Glad you're feeling better. Thank you. Then we'll go to Ken, and then Councilmember Delgado, and then Sama, and Scott.
Waiting for me. Kendall Narsick, Jamestown Town Administrator.
Thanks for joining us.
Hey everyone, I'm Paloma Delgadillo. I represent Broomfield Ward 2. Happy to be here.
Thank you.
Hello all, I'm Sam Fox, Deputy City Manager for Louisville.
Thank you.
Hi everyone, Scott Furley. I'm chair of the Niwot Local Improvement District, and just not in the healthiest of ways right now, so just staying away from everybody.
We appreciate you and your choices. Take care. All right, and if anybody else jumps in online, I'll try and catch them just so they get an opportunity to introduce themselves tonight. So we'll start on this side of the table and we'll go to the back and then back to the table. Hold on.
I'm Jonathan Kane, Town Manager of Netherlands.
Thanks for being.
Hey everybody, I'm Megan, I go by Meg's, she, her, and I serve the board. Hi everyone, I'm Wendy Schwartz, I'm the Human Services Senior Manager for the City of Boulder.
Thanks.
Hi, I'm Tessa Hale, I'm the Health Legal Systems Change Advisor for Boulder County Public Health.
Thank you for joining.
Hey everyone, Jen Cowish, County Superior Council Member. Claire Levy, I'm another Boulder County Commissioner, and I'm just sitting in on this meeting to hear Michelle's presentation.
Thank you.
I'm Lauren Folkerts. I'm the Mayor Pro Tem for the City of Boulder.
I'm Sean McQuay, along with City Council.
And Nick Robles, staff with Boulder County Commissioner's Office.
Thank you. And I just want to check online because this room sometimes is not the best for audio. If you can just, somebody give us a signal if you can hear the speakers. Well, no, thank you. I just want to ask because sometimes we don't know what's happening on that side. And I'm Martha Loachman. I'm one of the Boulder County Commissioners. Thanks everybody for being here, for joining us. So let's start with Michelle Webb. She's a manager of behavioral health system, and she's going to present to us, and we'll have enough time to ask some questions and have some dialogue too.
Excellent. Thank you, Commissioner Loachman. Let me share screen with everyone. Just adjusting a couple things here. 1 second.
We can at least start seeing, we're seeing
Okay.
what you're, there you go.
Awesome. Excellent. Thank you for letting me know that. Everyone, it's great to be here with you this evening. Sorry I couldn't be there in person with you all. I have the bug that's going around too. But as I mentioned, I'm the Behavioral Health System Manager for Boulder County, and I'm here this evening just to share an update on how things are going with implementation of the Behavioral Health Roadmap. And I think many of you know what the roadmap is. I think most of you participated in the roadmap at some point as far as development goes. But I do want to start just with sharing a brief background and history on the work. And where we'll start with is just a reminder of the vision that was the outcome of the roadmap. And it's twofold. It's that all of our community members can get the right care at the right time for their mental health needs. And that they're able to do it in a community where they feel a strong sense of belonging. So that's the vision that we're aiming for. And I think it's important that we stay grounded in that. Now, the history of why there needed to be a roadmap, it's that our system, some people would say it isn't a system. If you are trying to access care, you will find that it's highly fragmented, it's poorly coordinated, it's really hard to navigate, it's hard to get connected to the services that you need. There are many barriers to care, and we lack a comprehensive range of services and supports here in Boulder County. And that's been something that's been persistent for a long time and that was part of the impetus of the roadmap coming to be. Now, back in 2022, the decision was made to pursue the roadmap, to find out what it is that our community needs, what is the vision. And there was a team that was hired to come in and do engagement work. So there was intensive community involvement, over 600 different people, subject matter experts, as well as community members participated in that process over a year, somewhere between a year and a half to 2 years. Through that process, the roadmap itself was developed with its vision that we just visited, as well as guiding principles, goals, and strategies. If you want to visit that document, I have links at the end that you'll be able to see. But it was about 130 pages that ranged from things that were very practical to things that were very audacious. But that is our community's vision for where we're going with this work. In 2024, the county then made the decision as a next step to hire staff to go do the implementation work. So my role was brought in March of last year, and our program support specialist, Morrison Donovan, was brought in August of last year. And we spent the remainder of 2024 working on forming our governance groups. So the roadmap has oversight from three different groups. We have our Behavioral Health Executive Advisory Board, which consists of members from the city of Longmont, a representative from the city of Boulder, representative from Clinica, and then also the county departments that touch on behavioral health services. So we have community services, human services, and public health are represented there. We also have an operations group that has a much bigger representation of partners and providers. And we have a community group as well that we've been convening quarterly. We spent through, after forming those groups, we spent our time developing an implementation plan. At the end of last year, when we had that plan ready to go, we also did a process of looking at, okay, to actually execute on this implementation plan, what would that look like? What is the scope of this work? And we identified at least 55 different projects with even more deliverables for what is essentially a small but mighty team on the behavioral health planning team to go implement. And that's where we realized, okay, we really need to look at how do we focus our work on what's doable in the short term, near future, while laying the foundation for the long term. And so going into this year, 2025, we focused on these key work areas. So the decision was made that we would pursue a behavioral health strategic plan that includes that implementation plan. And the reason for that is that we wanted to bring things from the roadmap kind of down to earth with what is the work that the behavioral health planning team can actually hold and what's doable within that work. So what is it essentially that the county can hold? Whereas the roadmap, there are pieces that the entire community holds, not only the county as an agency. And that document is much smaller. It's somewhere between 20 and 25 pages. I can share that with you, and I'll put a spotlight. We'll talk a little bit about what that looks like in just a minute. We also focused on funding and sustainability. So for the work that needs to be done for our services and programs for our community members, how is it that we'll fund and sustain what we need for our community? We also started laying the foundation for evaluation. So coming up with a dashboard of community outcome indicators and also working on a centralized set of KPIs with this work starting internal. So looking at our county as an organization across different departments and divisions, coming up with a centralized set of key performance indicators for how we measure things. We also did a significant amount of work around improving collaboration and coordination across our partners, whether internal or external. So much of the feedback that was received through the development of the roadmap is that our system is not well coordinated, and it is sometimes really challenging to collaborate with each other. And there are many silos that we need to break through. So really laying the foundation for that work. And then finally, beginning to work on what is a central knowledge base. So an information hub that our partners can access that is more about resources, such as what's happening with funding, what are changes in the funding landscape, what's happening with policy, being able to share data there, and any emerging practices that are developed, because there are many things in the roadmap that will rely on emerging practices. So really being the ones to hold that information in a central place that everyone can access. And I wanted just to highlight a few of those pieces of work, one being the strategic plan. And I won't go into great detail about the plan, but really just wanted to cover what the goals were. So again, this is the work that the county agency and the behavioral health team can hold. So it's ensuring that we have effective governance and accountability over this work, making sure that we have that long-term service and system sustainability and doing that through a strategic funding plan. We need to work towards improving the system effectiveness by increasing and improving that coordination and alignment across partners that I just talked about, and addressing the system fragmentation, and doing that through both from the leadership standpoint, but also from the communication standpoint, because that's where a lot of that fragmentation comes up. We also are wanting to make sure one of our goals is around community and stakeholder engagement. Our community participated in, they invested a lot of time in the roadmap, and we want to make sure that they are involved throughout implementation and that their voice is represented there, ensuring that behavioral health services are equitable and culturally responsive, and monitoring our progress and outcomes through that comprehensive evaluation that we're working toward. For funding and sustainability, what we were able to accomplish this year is in the strategic plan. If you read it, you'll see that we developed a framework for a strategic funding plan. So it's really the groundwork for us to go do a full strategy. This is, you'll see in there, it includes if there is a behavioral health tax that gets passed. It also talks about if there isn't. So really looking at it from both perspectives. This strategic plan that we developed really is intended to live regardless of that, because the work of implementing the roadmap continues regardless of that. We were able to conduct the research and development for a behavioral health tax. And I think, as everyone in this room knows, there is a tax on the ballot, and the voting results we will have next Tuesday or Wednesday, I believe. As part of that, so looking at funding and sustainability, we worked through our governance groups with the executive advisory board, the ops group, and community members, as well as taking in so much information from the roadmap itself to say, what are the most fundamental services that we would need to have exist to be able to call it a sustainable system? So went through the process of identifying those core services. And then since that time, knowing that now the tax is on the ballot, we've been working towards planning for potential tax implementation should our community decide that that is what they want for our community. Another key piece for us this past year, and will continue to be, is around strengthening that cross-partner collaboration and alignment. So as I've already said at least twice now, that's the big challenge. One of the big challenges that the roadmap really spotlighted is that need to improve those cross-system partnerships, the collaboration and the alignment that happens, making sure that we're all moving towards that same direction. So we've spent a lot of time, Heidi Grove, who's here, and I have spent a lot of time convening partners who are partners in the homeless response system, but because that intersects heavily with the behavioral health world, bringing them together to see how is it that they can build better collaborations together, and really trying to help them spot new opportunities. We're doing that with different teams around the county organization, including human services, the team that manages funding through the opioid work, and public health as well. And then also we've worked with our partners, so specifically those 3 or 4 different departments I mentioned that each within the county touch on behavioral health, as well as City of Boulder, City of Longmont, and Clinica, to look at doing an intentional approach toward alignment. And we've been able, across all of those partnerships, to come up with an agreement for how we would start that work. And that's something that we envision doing more formally in the upcoming year. And then one thing, when you put your slides together and you always think, but I really wish I would have said this or that. Looking at this, I wish I would have had a third column here. And that one would be about trust building. We have invested significantly this past year in building trust across our partnerships. So really focusing on those relationships and those one-on-one conversations, because with this work, we know that there are hard conversations that need to be had, and we want our partners to know that there's a safe space with the behavioral health team. If there's something they want to raise visibility to that they may not feel comfortable talking about within a group setting, they can come to us and we can strategize for how we navigate the politics in the situation to make sure the conversations that need to be had are had. And then looking ahead, will be similar categories of work. We're just going to go deeper in our ongoing work. So with funding and sustainability, we're looking at that actual strategy. So as I mentioned, we have the framework for this funding strategy, and it's moving forward on actually developing that and implementing it. Communications wise, we want to strengthen that system-wide communication to make sure that we are helping support informed decision making. So when we talk about silos and fragmentation and moving towards a system that's cohesive, we have to have that communication be strong. Implementing a partner-driven approach to reducing duplication and increasing coordination and alignment in our planning efforts across all of the partners within our behavioral health system. And then on evaluation, because we want everything to be informed by data and we need to be monitoring things as we go. What's the progress that we're making and what are we seeing with the system shifts? With all of that being rooted in community and rooted in outreach and engagement so that our community is involved the whole way through. So that is what I have to share for the update. I have my contact information here. I would love to connect with any and all of you, so please feel free to reach out anytime. I also have the URL for the roadmap report itself is right here. The one for the strategic plan is really long, but if you search on Boulder County Behavioral Health Strategic Plan, it pops up right at the beginning. So thank you, everyone.
Thank you, Michelle. Appreciate you being here to present. Are there any questions for Michelle on the update of the strategic plan and implementation that's happening?
I guess, it seems like we're still kind of at big picture thinking for the most part. Is that kind of what and I assume we'll get future updates about sort of what the strategic investments or sort of things might look like in more concrete terms. Is that fair, or is that a fair assessment of the process?
As far as strategic investments go, the behavioral health team does not have a budget to work from. So that really will depend on the outcome from the ballot next week. If there are funds to invest, and certainly that will be something that communities and partners are involved with as far as communicating what's happening there. And as I mentioned, we're already working on what is the plan for those funds. As far as implementation itself goes, we spent, much of the work we did this past year is what I call more academic work. It was a lot of the planning and getting the different puzzle pieces in place. And this upcoming year is when I think you will have the opportunity to see actually more tangible results from that. And it is something that I think you had asked about hearing future updates about that. And our intention in the upcoming year is to hold at least 2 convenings, specifically where we're sharing those updates. But as part of that communications focus that I talked about, it's also pushing out those convenings. So we want to get out to where people are at, and are happy to come meet with this group or in other spaces with you all to be able to share things as they progress.
If it's okay, I'll just add that implementation plan, the strategic plan that Michelle referred to with the long URLs, as I just Googled the name of it. That is on the website. It hasn't been formally presented to the board typically we would have a public hearing on it, just as we did for the behavioral health roadmap, and provide some input and feedback on it. That'll take that big high level work of the behavioral health roadmap down to something that's much more concrete.
And I heard a little bit of a question, maybe, Mayor Pro Tem, around if the behavioral health roadmap, strategic plan or implementation was and so I heard it as a question about them returning to give updates, but I may have misinterpreted you.
I was
listing as
very
city hall.
vague in my question, so there was a lot of room for interpretation. I appreciate the the variety of takes on it. I think those are all useful. And yes, I would love to have it come. I'd be interested in having it come back, potentially learning more in a future update.
Yeah, that's great. So I would just say, when we talk about kind of, that'll be a post-it, but when we talk in December, because we'll be scheduling the updates that we have for 2026. And we could add this one in there as an update, the way we did for the folks working on minimum wage separately, that came back in an update, the way that we have the RTD, that's an annual event for us. So just something to think about when you're putting in your asks for 2026.
Appreciate that. Thank you.
Any other questions from Michelle? That's great, thank you. And so when Nick will send out the recording, Michelle, and so if you want any additional documents or links to either your presentation or the URL, etc., just make sure he's got that, and then he can send that, but it probably won't be until end of next week. So you have a couple days to get that over if you'd like to add anything. Thank you.
Thank you for that. I will. Thank you.
Appreciate that. And you're welcome to stay. And we also understand if you have an evening that you want to get to. So no pressure at all, but you're invited.
Thanks for that. I'm not going to miss this. I will stay. Thank you. This is an important topic. I want to hear what others have to share too.
That's great. All right. Well, then let's jump into the presentations that we've got. I do want to just ask if there's anybody that is under a time constraint that needs to try and move themselves to the front of the presentation line. I didn't hear anything, but I always want to ask in case someone's trying to get to their next meeting. Okay. Well, then let's start with, I heard, and I'll look to Nick, because I heard Broomfield had a presentation. And I don't know who else. Oh, Christina. Should we start with Longmont?
Please. So she needs.
Oh, we can if you want to. Yeah, I was just saying I had a presentation, but I'm not in a rush to go anywhere.
Oh, that's great. No, we can start with Longmont, and then we'll go to Brookfield, and then we'll go to Jamestown.
Okay.
And then Niwot.
Yeah. Nick, did you want to share? Do you want me to share? Does it matter?
Um,
You want me to try?
yeah, please. Sorry.
Okay. No, you're good.
I
You're
don't
good.
see it.
Let's see. I think I can do this relatively easy.
And Christina, if you don't mind, it looks like we maybe had a couple new people join us.
Sure.
If there's anybody that joined us online that didn't get a chance to introduce themselves, let's do that before we start into the presentation. Name and title.
Thanks, Commissioner. Holly Rogan, Mayor of Lyons. Happy to be here. Sorry I'm late.
Thanks for joining. And then I thought I saw
Neil, I think. Neil from Erie, yeah.
Councilmember Neil, I don't know if you're available to just do an intro. If not, we saw you join.
I'm here.
We just want to make sure you got a chance to introduce yourself.
Yeah, hi. My name is Anil Pesmelli. I'm council member from town of Erie. And
Thanks for joining us.
yeah.
Thank you.
Thanks, Christina.
Okay, are we good to go?
Yep.
All right. Can everybody see my screen?
Yes.
Great. Great. So, let's see if I can, get it to switch. Okay, there we go. So the way that the city of Longmont defines mental health is a person's emotional, psychological, and social well-being. impacting how individuals think, feel, and behave. And so really the work that we do around mental health really is helping individuals learn how to handle stress, really relate to others, and make decisions. And it's really what we've been focusing on over the last year and a half, and I'll get more into this, is support for individuals in our permanent supportive housing developments. So the work that we've done to address mental health within the city of Longmont is really around a mental health center of excellence. So individuals who come from different orientations, from different areas of in their education, coming together and working collectively to do some problem solving. What we found prior to, and that's the little graphic here, prior to really implementing this center of excellence and working within the city, we found that people were working in silos. So we had people in children, youth, and families, in public safety, in senior services. We had funding through our nonprofits, through Human Services Agency funding, that were all working on mental health, but really there wasn't a coordinated effort. 2 years ago, council made the decision to use 50% of our marijuana tax revenue to hire clinicians to work in our permanent supportive housing development, specifically at the suites. We hired 2 clinicians, have since then hired 1 more, and we're now looking at using more of that tax revenue to continue to replicate this model. What we found through some internal changes with the Longmont Housing Authority, as well as these external supports, is that our evictions went down. People in general had a higher satisfaction living at the suites. There was more a sense of community, and ultimately impacted, the areas that we talked about before, how people were handling stress, relating to others, and really making decisions. And so in general, that's kind of our approach to addressing mental health. What we found over this last year is that it is even more imperative that we work more closely with our public safety partners in court and lead, because we know that clients tend to travel through those different systems. We see the same clients through housing and community wellness that ultimately, when they are more acute, often end up tapping into public safety services. And so what this approach has also allowed us to do is to use those public safety resources for which they were intended. So we have been able to work with clients kind of at a lower level of care through housing and community wellness, without them accelerating into kind of the public safety system. So really, this is the why behind why we chose the Mental Health Center of Excellence as a model to implement this. We saw an increase in mental health acuity. We knew that we needed support for our formerly unhoused to make sure that they stayed housed. So in our partnership with homeless response, we know that a lot of work goes into securing housing for people, and it doesn't help them, doesn't help the community if they don't have those supports once they're in housing. We know that we wanted to specifically support those in permanent supportive housing communities. We, in looking at the, whether it's the lowest hanging fruit or the area that needs the most support, that's really where we felt like we wanted to put those resources. It offered us the ability to provide a more robust level of support to support their success, transition, and self-sufficiency. This also had not only a benefit to clients, but also for employees. What this has allowed us to do is to be more nimble with where employees live within the organization. We may have a clinician that comes in that starts as a clinician 1 or 2, But we know that ultimately where we might need to hire is in the clinician 3 area for public safety. So that allows kind of like a career path for employees should they want to work in different areas of the organization. I think that helps for retention as well. And so the overall goal is definitely the mental health support, but also the therapeutic case management. Oftentimes it isn't about that therapy, about that one-on-one therapy, but it's how do we help people connect with other systems through housing and community wellness. We have a strong partnership with Clinica and their case managers. We have biweekly meetings with the team there and look at how we can wrap clients with that support. The metrics that we use, we spent a lot of time this last year and a half figuring out the way that we communicate, the way that we document client work. What we also found out through our Mental Health Center of Excellence work is that everybody was using a different system to capture their data, to capture their metrics. So we had we did a lot of work around implementing Salesforce to track client progress, to track referrals, so that senior services is looking at the same data and metrics that children, youth, and families are looking at, that housing and community wellness are working at. So a lot of what you'll see and what you'll hear from me tonight is really us getting our own house in order internally because of that siloed approach that existed before. Of course, our focus is on keeping individuals out of higher level of system involvement, whether it's in our unhoused services where we're working with people who are formerly unhoused, or whether it's in Rewind with our adolescent work. We want to keep them at a lower level of system involvement and not accelerated into the Department of Youth Corrections. And again, whether it's adults, single adults, families, we want to keep people housed. We know that there is a connection between that stress and being able to keep people housed. So that's another area that we look at. So the collaborative work, as I mentioned, the focus has been on creating that mental health center of excellence within the city of Longmont. That's not to say that we don't have involvement in larger collaborative efforts. As Michelle said, we are involved in that in the homeless response systems. The Human Service Alliance nonprofit, our St. Vrain Community Council, we're pretty involved with all of our nonprofits, not only in the partnership aspect, not only in the funding aspect, but the partnership aspect of how we're wrapping clients with services. We also have some opioid abatement funds are part of that collaboration. And I've already mentioned the partnership with Clinica and the suites. Again, the work has primarily been around internal work, doing a SWOT analysis of what we have internally, where some of those gaps are, how we can branch out, and how we can more effectively do this work in the community. I myself sit on the executive advisory board and work with Michelle, see her at least monthly, have had lots of conversations about what Longmont is doing and kind of where we want to be. I think that's about my 5 minutes, if not a little more. Does anybody have any questions?
Thanks, Christina. Questions for Longmont? Heard a similarity and kind of the get our own houses in order. the high level, how to address silos. I heard that in both of the presentations. Thank you.
Yep.
Thank you. And
All righty.
To
Thank
reach
you.
out. Questions.
Thank you.
Thank you.
All right.
Sharing.
Broomfield was next.
I think Boulder wants to go.
Oh, I can go whenever.
Oh, okay. Cool. Sorry.
Okay,
Well,
did I stop sharing or can somebody else?
You're still sharing at the
I'm
moment.
still sharing. How do I stop sharing? I know how to do, let's see. Share. I'm sorry. Now you're hearing my
I can
dog bark. Can you stop my sharing? I
Yeah,
don't know
yeah.
how to do, Nick. Thank you.
I'll
Thanks.
try. So we're gonna go Broomfield?
Broomfield next. Yeah.
Okay.
Thanks.
Okay.
Oh, perfect. Cool. You got my slides. That's even more convenient. So, I would like to first point out that this has my name on it, but it was director Jason Balling who really put together everything. So I wanted to give a little credit there. Next slide. So we define mental health in the following way. All Broomfield residents should have the opportunity to attain and maintain a state of mental well-being, allowing them to realize their potential, cope with life stresses, and thrive in our community. And then we got some fun little posters for things that we got going on and stuff. Next slide. So some of the things we're up to, we're continuing to implement our behavioral health improvement program. So we are in year 6 of it right now. This was developed in conjunction with community partners, and this was revised last year to reflect the current environment. This involves braiding together multiple funding sources. So a lot of the similar sources that were discussed in the previous presentation. And then we focus on prevention, early intervention, and linkage to care. The Behavioral Health Administration is the lead on treatment. Next slide. So this is where things get a little wordy, but I think it's good detail. So within our plan, we have some objectives. The first objective is that by 2029, we want to increase awareness and understanding of mental health and substance use among Broomfield residents in order to help reduce the stigma and discrimination associated with behavioral health diagnosis and seeking treatment. So we got some strategies and some actual tactics for this. The first is to promote positive change in community norms by increasing awareness of behavioral health through engagement of community. In order to do this, we need to educate the community through local media campaigns focused on positive social norming on substance use, and then also promote community members to facilitate discussions and awareness of resources to support behavioral health. Another strategy we have is to decrease stigma associated with behavioral health. To do this, we run local media campaigns to reduce stigma towards mental health and substance use and include Spanish language campaign materials. Next slide, please. So objective 2, second thing we want to do is that by 2029, we want to increase access to behavioral health care services among Broomfield residents to help people manage conditions that would otherwise limit their social and economic participation. So once again, strategies and tactics for this. First is to increase the community's knowledge and ability to navigate existing resources. In order to achieve this goal, we need to continue community-initiated care training programs with an emphasis on offering culturally diverse opportunities. We must promote mental health resources, webpage for a variety of stakeholders, and we need to fund school-based prevention and interventions. Then the next one is increase access to care for substance use issues. To do this, we'll provide stipends for treatment and recovery living for people with substance use disorder, and then provide free naloxone to community members with emphasis on priority populations. Next slide. Then finally, objective 3, at least I think that's finally, it'll surprise me if there's one more. Increase awareness of importance of social connection within Broomfield to foster a healthier, safer community, ultimately leading to improvement in positive mental well-being. And then in order to do this, we need to increase social connectedness across the community. For this, we want to target a few areas, advocate for safe spaces for youth, especially LGBTQ+, low income, and youth of color, increase funding and access to school-based activities and community pro-social opportunities for youth, especially, again, those LGBTQ, low income, and youth of color. We need to improve access to and awareness of the importance of trusted adults in preventing youth substance use, promote mentoring training, training on positive youth development, and media campaigns like Forward Together and Connect Effect. Then finally, research emerging practices for connectedness and determine what is feasible to implement within the Broomfield community. Next slide. So we need to track this progress, of course. In order to do that, we're seeing a decrease in the percent of we want to see, these are our goals. We want to see a decrease in the percent of high school students who report using substances. We want to see a decrease in the percent of high school students who felt sad or hopeless almost every day for 2 weeks or more in a row so that they stopped doing some of their usual activities. And we also want to see a decrease in the percent of residents reporting 8 or more days of poor mental health within the last 30 days. These are our long-term goals. Next slide. And then this is kind of how we're doing. So a lot of statistics, I'll try to kind of skim through these. So thankfully, we're seeing a downward trend for all of these. So percent of Broomfield and Boulder High School students who report using substances, decrease in marijuana, alcohol, cigarettes, vape products. And then we're seeing kind of this prescription drug use of 2.6%. So I should say that those percentages are not an increase or decrease. The arrows are the trend, and the percentages are the actual percentages that we're seeing for clarity. And then another item, we want to see a decrease, and we thankfully are seeing that decrease in the number of high school students who felt sad or hopeless almost every day. So that was that item. Right now it is at 22.4% of students. We obviously want to see that improve even further, but thankfully it's trending in the right direction. And then the percent of students or residents reporting 8 or more days of poor mental health. So that one is not in a great place. That one, we want to see it decreasing. That has increased a bit, and it's about at 23%. And then rate of deaths due to suicide, want to see that decrease. That is actually flat with 12 Broomfield residents. Next slide, please. And then collaboration, what do we have? So currently we have 2 active coalitions, Communities That Care and the Behavioral Health Coalition, with all of these partners, which I won't read out for you guys, but we thankfully have a lot going on. We collaborate a lot with Boulder County Public Health, so thank you to you all for being great neighbors. Opportunities for collaboration we have. Further supporting schools, so middle schools. I don't know about you guys, middle school was rough for me, so I can definitely see that being a great place to improve our outreach. Faith-based communities, business community, and regional partners. So there's a little bit more opportunity to get even more keyed in. Next slide. And that's what I got. So thank you all for the time.
Thank you so much for some really great specific targets and information. Any questions for Broomfield? Yeah, go ahead.
Paloma, thank you very much for that. I just had a question, if you know, on the data on the high school kids, you know, it's Boulder / Broomfield, you know, because of the overlap in the school district. Are you trying to tease out the Broomfield kids that are in the Boulder school system, or is that just overall high school numbers?
Yeah, that one I'm pretty sure is just overall for us. I think we called out Boulder because we're acknowledging that we're a part of BVSD, but yeah, that's a good question.
Okay, yeah, thanks. I didn't think you would necessarily be in the weeds on the data thing.
Yeah, totally.
Any other questions? Thank you so much.
Thank you.
We have, let's see here. Oh, Boulder. I don't remember who did I say. And we have, we're right before our break, so I think let's try and get through at least one more, and then we'll decide if we want to keep working through the break or if we want to. How many more presentations do you have?
Nick, are you gonna run the slides?
Yeah, sorry, let me
Okay,
pull it up.
great.
And I'll just ask while you're doing that. Does NIWAT have a presentation tonight? Just looking at the clock and scheduling.
We do not. We're just excited to hear what our county's doing in our surrounding areas.
Thank you. Ken, were you gonna present tonight? I'm just trying to look at our schedule.
Sorry, I didn't get, who did you ask that question to?
Oh, I was asking Ken.
Ken. Okay, great.
Thank you.
No, I'm an observer today.
Thank you, Ken. I appreciate it. All right, let's hear from Boulder.
Okay, well, thank you. Again, my name is Wendy Schwartz. I'm with the City of Boulder, and I'm here supporting our Mayor Pro Tem tonight. So thank you for the opportunity to talk about what we're doing in behavioral health in our city. Next slide, please. I know one of the questions is about how we define or think about this area of health. And in Boulder, we talk a lot about behavioral health, thinking about that intersection of mental health and substance use disorder. And we also talk a lot about the social determinants of health. So really those non-medical factors that influence your behavioral health, which might be whether or not you're in safe, stable housing, what sort of access to healthcare you have, et cetera, et cetera. And so we look at that big picture when we think about behavioral health. And in 2024, we created for the first time a City of Boulder behavioral health framework, which was presented to our council in January of this year. And we did this because, like many communities, our residents have become increasingly concerned about behavioral health, but it was largely outside of our city's traditional roles and responsibilities. And so until recently, we didn't really have any formal guidance about our role and responsibility. So our framework does define our role and priorities in supporting behavioral health. And since I don't have 30 minutes, I have 5 minutes. I will say that there's a lot in there and we'll touch on some highlights, but at the end, I'll share the website. So if anybody wants to look at the larger framework document. I will also note, Michelle, great to see you. Hope you feel better. We were participants in the countywide roadmap process, and we really started working on our framework as that roadmap process came to an end. And part of the way we think about the framework is how do we define the city's role under that broader umbrella of the countywide roadmap. Next slide, please. There are 4 primary ways that the City of Boulder supports behavioral health. One is with direct services, and in particular, we're mostly talking about our behavioral health crisis response team here. And so some of you formerly have probably heard of programs called CERT and CARE. And now those programs are an integrated team of licensed mental health clinicians and case managers that can respond with or without police, depending on the situation, to calls that come into 911 or to our police non-emergency line, which really seem to be grounded in behavioral health. That program has an annual budget of approximately $1.8 million. One of our biggest roles is the funding that we provide for community organizations that provide behavioral health services in the City of Boulder. And that's primarily through our city's competitive fund rounds. And in 2025, the subset of our community funding focused on behavioral health is approximately $2 million. We, of course, like other partners, have occasional opportunities for one-time investments. So an example recently of this was when we used some of our ARPA money to fund the startup costs for the Hope Institute Suicide Prevention Clinic coming to the City of Boulder. And when we think about that social determinants of health area, of course, we have significant affordable housing funding, and that's really a key part of people being well when it comes to emotional wellness. We, like all of our partners here, we have our collaboration and partnership role. And we think that's one of our really important roles because when we do work together, we can do a better job in making more strategic and impactful investments. So examples of that include our partnership on the Regional Opioid Council, the Roadmap Executive and Operational Boards, of course, our work with Homeless Solutions for Boulder County. And finally, we have a role that I think is easy for organizations to really overlook or not think about, but it's your employer role, right? And in the city of Boulder, we have about 1,900 employees, and many of them really, they do interact with the public. And so making sure that we have an emphasis as an employer on supporting our employees' complete well-being, including their emotional well-being, really helps them as individuals and also helps the community when you do your job a little bit better when you are well. Next slide, please. So here are 4 priorities that are highlighted in our behavioral health framework. The first is preserving and integrating those safety net services, really making sure that the place people have to go when they have no other place to go is in the best shape possible. Making sure that we support capacity in the community to serve individuals who have very complex needs, with a particular emphasis on youth and older adults. Service navigation and connection, and I know I've heard some of our regional partners talk about that tonight, and it is the case that sometimes the services don't exist, but sometimes the services do exist and people either don't know about them, find it overwhelming to try and connect with them. So really that navigation is important. And then finally, 2 categories that really come up from our community a lot and are our top 2 categories of response for our crisis response team. That's suicide and substance use disorders. Next slide, please. On metrics development, as with some of our partners, that is a work in progress for us. And part of that is we have a great partnership with Michelle and others on this call. And we are looking to align as many of our metrics as possible with the metrics being developed for the countywide strategic plan. We do, however, have some metrics that already exist as strategic outcomes in our department plan, in our citywide plans, and I've put a few examples on the slides. So one long-term example is reduction in people experiencing crisis and emergency mental health holds through the ER. And I know that's also something or something similar to that's being considered for the countywide plan. A short or midterm example would be increased access to services or reduced barriers. So that would really look like reduced waiting time for services or increased slots in different services or services that didn't exist before in the community. And then to get down to kind of a program contract outcome level, I pulled this example from one of our contracts. At least 70% reporting low or moderate psychological distress at reassessment compared to baseline. Next slide, please. So that is it. I think most people here know how to contact me, but if not, I put my contact info on the slide, and then down there in the blue box is our behavioral health website that includes a link to our behavioral health strategic framework.
Thank you. Any questions for Boulder? Thank you. Yeah, appreciate the presentation information. So we've got, I believe we've got Louisville,
We can have that this way.
Louisville, Superior, Erie.
I'm just trying to gauge if we have time for it or not. Thank you. Okay. How are we feeling? If I can get just a thumbs up from folks, if we want to take a break or if we want to just keep moving. So thumbs up would mean let's just keep moving and everyone feels okay. And if anybody's like, I really need a break, then, and people can feel free to move around if you need to too. Okay. We'll just keep going here.
Hey,
And
Marta.
yes, of course.
Hi, this is Caleb Diggins again with Louisville. I have to step away in a few minutes. We don't really, we don't have a formal presentation or anything like that, but I just wanted to chime in that it's, it's really great to hear what everyone's working on. Obviously, one of the things that's great about Consortium of Cities, right, is that we're all part of a bigger network, and Louisville definitely depends on our county and different things. But it's nice to hear some of the concrete examples of actions being taken and talking about tax dollars being used for the specific stuff, because I know that one thing that I think about a lot, and it was brought up already, of course, is just the sometimes it's housing insecurity and job insecurity and food insecurity and drugs and alcohol that create some mental health issues, and then sometimes it's mental health issues that create those insecurities, and you can address the issue from both directions. And I think that it's so important that we're looking at it from all those sides. And so there's a lot of things that Louisville does without necessarily having major mental health system here to help people directly. There's so many things that we're focused on trying to support our residents, but we lack a lot of those resources to do the actual mental health work, right? And so we rely so much on so many people and Boulder County Health in particular to help us. So just really thankful for everyone that's around us and the support we have from everybody, and that it's a big topic that is not solved with any one tool. But when we're thinking about all these different angles and all the different stressors and traumas that create mental health issues and all the different versions of solving it, it's fantastic. And having two kids, getting therapy themselves for their own mental health, it's just a good indication that we all need it. Everybody needs it. We need access to it. And so thanks again to everyone who presented, and sorry I have to run a little bit early, but I've really enjoyed listening to everybody.
Thank you, and thanks for sharing your experience and your perspective with everybody. I think it's helpful, like you said, to know we're part of a bigger region and area outside of just our town or city boundary. If you get a chance before you have to log off, Mayor President, if you could just do your vote for the scheduling option time, because that'll be the last thing we do tonight. I put it in the chat if that's an option for you to look at.
Yeah, sorry, I will vote in the chat.
Okay, I was gonna say, or you can just tell me right now.
Let me bring it up. My technology stuff right now. I'll look at it before I go.
Okay, thank you. What about Superior?
This was a tough question because my immediate thought when I saw it on the agenda was like we don't have a formalized mental health program or support system. But then as I was thinking about what our community, I've only been there for 5 years, so coming into it during COVID and then the Marshall Fire recovery, and I think our heaviest reliance, and I can say in metrics, we've added another co-responder, and so we rely heavily on the Boulder County Sheriff's Office, and the co-responders do a lot of work in our community. But I think where we focus on mental health is similar to what Caleb said about we kind of when there becomes an issue in Superior, we start referring out to places like ACC or mental health partners, or and so these are things that we get as a benefit of being adjacent to all the work that's being done for these programs. But there's also a softer lift happening in community about belonging and creating, like we used to have 15 events and now we have 40. And those are the kinds of things where we get touch points with community members, the PBSD mental health support that comes into our schools. It's just,
it's a very small town, and I think we see each other more, and we're able to use some different tactics that are, I think, are happening in all communities, but it is, we rely on it, I think, a lot more in Superior. And then when something is bigger than what we can handle, then we know we have this back, these essentially wraparound services for us, for all of the available programs that are in Boulder County. So much appreciated, but this is giving me a lot of questions to take back about how we can stand up more communication about mental health and what we can create as a foundation for people in our community to look to us, because I don't think that they do. And it's highlighted I think something that we're lacking. So I appreciate it.
Thank you. That's good. Letting us know what's now on your mind too. That's helpful. And I think this is the beauty of having these conversations, because there's no reason why you need to start from scratch. And now you have all these different examples. So whatever resonates, I know everyone's willing to share and talk with folks. Erie, did you have a presentation? Anil, did you have a presentation? He might not be. Like all of us doing other things. What about Lions?
Sorry, I couldn't find my unmute button. I don't have a presentation. I'm really grateful to hear what everybody else is doing, and I just want to chat for a minute about a couple of challenges that we're facing in Lions. One is that we lost the co-responder that we had, who was pretty much always in town. And that program was so highly successful. So we're working with the Boulder County Sheriff to try to get more coverage and hopefully get a co-responder back in town more consistently. The other challenge that we're facing, and this is a budget challenge, which is one of the reasons I was late tonight, is that we dedicated our marijuana tax to funding mental wellness and substance abuse prevention and treatment programs. As I think we all know, the state portion of the marijuana tax was cut in the last legislative session. It looks like it's going to be cut more. So that means we're going to have a lot less funding to give to our local mental health partners like LEAF and Lions Community Foundation for these programs. So we're looking at ways to backfill that. But, as a small town, we don't have obviously a health department. We are very grateful for the county and the county services that it provides. But yeah, we're facing some challenges, and I'm excited to hear what other folks are doing.
Thank you. Thanks for joining us. Any questions for either Superior or Lions? Okay. Did I miss anybody? I'm trying to keep track of. I think okay. As far as presentations from groups, thank you, everybody. We have one more presentation, the housing needs assessment. That was one of the asks that people had said we want to hear this year, and just to have a good idea of what is going on in that area. So Heidi, thanks for sticking around this evening. And we've got maybe like 10 minutes, it looks like, maybe 10 or 15 with questions.
I will blaze through it. And I know it might feel like a little bit of a knee jerk of behavioral health, and now we're talking about housing needs assessment. But the reality, and I get a lot of questions about why is the Division of Homeless Systems and Coordinated Response overseeing the housing needs assessment work? Well, the answer is quite simply this: homelessness is driven between a combination of root causes and the intersection of individual risk factors. Root causes being affordable housing and access to affordable housing, and behavioral health being one of those individual risk factors. So, Mayor Pro Tem, you teed me up really great. So, I appreciate that. And happy to do a presentation at any point in time on all of those root causes and all of those individual risk factors if that's of interest in the future. We did do a town hall in January that really kind of talked about the homeless system overall. And that is accessible online if anybody is interested in reading that. And Jonathan, I see you in the room. My heart goes out to you guys. Please know that we've been thinking about you, and we sent Britt pizza because I know that it's just been a lot. So just wanted to acknowledge that. With
Thank you.
that, I will go ahead and I am not used to presenting in Zoom, so this might be interesting.
We can
I'm used to
see
Teams.
what you're working on, yeah.
Are we good now?
Ah, looks great.
Okay. So in September, how the Senate enacted a requirement for a housing needs assessment. That was in 24. And Dr. Cog was selected as the primary kind of force behind really driving these needs assessments for the state. We had the option, every municipality, every jurisdiction has the option to either sign on Dr. Cog or do their own. We opted in September with a unanimous vote of the commissioners, thank you commissioners, to go ahead and just sign in on Dr. Cog because the Department of Local Affairs has very high standards and Dr. Cog has already been approved. So this assessment is specific to Boulder County and unincorporated Boulder County. I do know jurisdictions like Longmont and Boulder proper are also doing their own individual assessment, whereas a vast majority of our other communities are signing on to Dr. Cog. So Boulder County, we are unique in the sense that we straddle a couple of different submarkets, which makes it very difficult to parse out without going jurisdiction by jurisdiction and then making sure that we have unincorporated completely covered. So when you see big presentations of housing needs assessments by submarkets and they're parsed out across the state, just please know that Boulder County straddles a couple. So just wanted to forewarn you guys. This should come as no surprise to anybody. Our deepest need in Boulder County is the 0 to 50% AMI. And that is where a lot of our households are really struggling. And then, of course, it tapers up to, the middle income and so forth and so on. This is our this is our 10-year local need by income. So this was done for 2025. So we're talking between now and 2035. Yes, that is a big lift. And we are fully aware. Oh, 2032. There we go. And this should also come as no surprise since we know that our deepest need is that 0 to 50% AMI. As a result, a vast majority of the households across Boulder County are severely rent burdened. And that really is defined by those that have to pay more than 30% of their take-home income into their rental market. So when you look at the split between burdened, which means they're like at the 50% or below, but above 30, so anywhere from 31 to 49%, that is the burdened market. Severely is 50 and sometimes up to 75%. So these are our permitting trends on what kind of units are we developing in Boulder County right now. Vast majority are 1-unit apartments. And so that does take into consideration when we look at the projections. This is our current supply. This is what we currently have available in Boulder County as of 2022. And of course, we've increased that. Think about like Willoughby Corner, some of the Boulder Housing Partners projects that have come online. This does not take into account, some of our permanent supportive housing that came online over the last couple of years. So that would be Zinnia and Bluebird Boulder. So this will increase next time they do the 2-year assessment. And this just kind of shows what our current portfolio looks like for single family homes versus townhomes or duplexes, smaller multifamily homes, medium multifamily homes. I'm still getting my voice back, but I'm getting there. And then mobile homes, which we have increased in Boulder County with the investment in like La Luna and Seward. And then this is really just the composition of how many are homeowner, like owner occupied versus renter occupied. And so we are seeing increases in the rental market versus home ownership market. And this is the composition currently. So if we think about the composition of the households that are in Boulder County right now, and then we think about the permitting, there's a little bit of a offset because we do have two-person households now that could be a couple and a one-bedroom could work. But we also are seeing a higher need for households with more individuals that is not matching the composition of the unit that we are generating currently. And these are our growth projections between now and 2050. And you'll see how they match our job growth. So household growth, job growth, they match exactly the same. And we are seeing growth projections for Boulder County. And this is just another way to look at, the justification of where that deepest need was from 0 to 50% AMI based on how many folks are actually, what their earning power is, and to make sure that they are able to meet that 30% or below on the rental market. So that helped feed those data to show the burdened market and then the severely burdened market with the projections. Disabling conditions, this does take into account the aging population, and we know based on the census data and the projections from this demographer that we are seeing a huge increase in those on fixed income that are aging in Boulder County. And I'm looking forward to the new data that's going to be presented on the 7th to see where we're at now. And which criteria determines the housing needs? I just kind of broke it down for you all, and this is the percentage of each that creates the composition. And this is again reflecting our 10-year local renter income needed. And again, it's at 0 to 50% that we're really lacking in the most in Boulder County. And again, this is AMI for Boulder County. And then the same for home ownership. And with that, I am going to open it up for questions.
Thank you. And Heidi, folks, I don't know if anyone wants to have a slide brought up, but just let us know. So Councilmember McCoy, you had a question, so I wanted to come back to you first.
I was just looking at those numbers. That was 141,000 single family units and 22,000 was it apartment units, making 163,000. That's what, is that what I'm seeing?
Heidi, you're muted right now.
See, I got all excited. I was like, mute, done. So Boulder County is 141. Yes, you are correct. And unincorporated, just unincorporated alone, sorry, is that 20,900.
20,900. Okay. All right. Just trying to think of those numbers there. Okay.
And I will say the one thing that I really liked about the Dr. Cog toolkit is you can actually go in there and select your jurisdiction and just get your raw data without anybody else's. Or you can filter it so you can put your date, like you can click Netherland and then Boulder County and it'll parse it out. And I'm happy to share that link. It's kind of cool to play with.
Thank you. Any other questions on the housing needs assessment? Great. Thank you.
You're welcome.
Get it? All right, it says 7:21. So we have two things we need to do. So I'm gonna invite the folks in the room while we are talking for you to stand up and make your way over to the voting board, because folks online are gonna do it in the chat. And so the question is, we're talking about 2026 scheduling, and we're just talking right now about meeting time. So I've been slowly moving this time. If you remember, it was like 6 to 8 p.m. when I first started. And so since I have the mic, the options are either for 2026. Option 1 is stay at 6 to 7:30, or option 2 is move to 5:30 to 7 p.m. So right now we're just talking about the time of the meetings. So if folks can just put your little tally.
In the
Yeah.
5:30 afternoon.
At 3:30 enough, that's what we got. So 4 o'clock, if you all can just put a tally underneath the option, feel free to walk around and do that while we are hearing updates or community events from folks. So maybe we'll start online. Is there anybody online that had any community event or update that they wanted to share about a specific item?
Well, as usual, I do. So this Saturday, the 25th, is our Spooktacular in Lyons, which is a really fun parade down Main Street. And we are also having a fundraiser for Netherland at the Wayback Bar. There's going to be barbecue and music and libations. It starts at noon. So if you're running around looking for something to do, come on out to Lyons.
Saturday, the 25th, starting at noon.
Yep, starting at noon is the fundraiser for Ned, and then the Spooktacular parade is, I believe, about 4:30, and then there's trick or treating downtown.
Okay, the fundraiser, is it like a lunch or what is the?
It's kind of there's going to be barbecue there for purchase, but it's sort of like an all-day thing.
Thank you.
Yeah, thank you.
I'm trying to see if I can fit it in.
Let me know.
Other updates? Other events?
In Erie, we have Boo on Bridge Streets on 25th from 3 to 5 p.m.
3 to 5 in Erie on the 25th. Thank you. Excellent. Yes.
Well, I want to thank everybody for supporting us in a big week, and especially Lions. Thank you for doing that. We have a block party as well on November 1st, and it's going to support both Net Fire and also the businesses, and specifically the employees, because there hasn't been a lot of resources for them. And it's going to be on the 1st from noon to 3, and we'll have like a bunch of kids stuff, and there'll be several bands, and it should be fun.
Thank you. Not my, I meant kiddos, but kiddos is fine. Listen.
Yeah.
Awesome.
I forgot to take my allergy meds.
Oh, I have one.
Okay.
Pedestrian costume parade for kids on Longs Peak Avenue in Kaufman, starting at 10 a.m. and going until noon. So it's a lot of fun. A lot of fun and a lot of mayhem, and dogs and cats and wearing outfits and stuff like that.
Very fun. I may have gone as Wonder Woman last year. I've been on that parade route. Very fun. Anybody else?
I'm hosting an event actually at my house. If anybody would like to learn more about Representative Brown or Brianna Titone on October 30th from 5 to 7 p.m.
October 30th. Okay. Thank you. Get a hold of Jen if you're interested in more. Oh, I see your note in there. It looks like a question.
I didn't know if you wanted to announce it since it's next Friday.
Thank you. So just to clarify,
there is it's not a fair. That's why I was like, oh no, what did I miss? But we have, and yes, everybody's invited. If you haven't got the invitation, please let us know. Next Friday on the 31st at 10 a.m. we'll be at the Willoughby Corner Community Room in Lafayette for a roundtable about alternatives for ADU financing. So we're not worried about folks who can get a traditional loan, trying to figure out creatively together with our regional folks. So that's that is on October 31st. The other one, if people are interested, there'll be a separate housing roundtable on November 7th. And that one is 2 to 3:30 p.m. We'll be back at Willoughby Corner in the community room because we're trying to throw off that amazing complex. But that one will be about what barriers are being faced for Colorado first-time home buyers to get into real estate, and we'll be sitting with Senator Bennett and potentially Congressman Negus and some other elected officials to talk about policy. So it could be very good for electeds to just, okay, what does that mean for me in the local? How can I advocate at the state level? And then what's the congressional actions that we need to do to help address homeownership? So everyone's welcome to that one as well. Thank you for that reminder, Heidi. You scared me when it said fair.
Well, I know that we've been talking about fairs, and so I apologize that wrong word.
No, it's okay.
It sounds like impressive. Someone's already
Right,
we get all.
Awesome. All right. Well, thank you so much, everybody. We have we'll make sure everybody finishes voting in regards to the schedule. We will have a next month will be the part of the agenda will be our topics for 2026 meetings. So please do put some thought in that. We'll make sure we send you a reminder and so that we can start that planning. I would love for everybody to talk to their councils and ask who would like to be a host in 2026 as well, just so we can start planning for that. And for, I don't know what other staff is here, but staff, thank you. We can't do our work as elected officials without you, and you all don't sign up to be here at 7:30 at night, but we do. So thank you to staff and Nick, of course, for getting the Zoom together and all the logistics to take care of us. So thank you, everybody. Be well.
Thank
Have a good
you.
night.
And now you've ruined all the meals at every other meeting.